I'm very happy to introduce our speaker for today, who's Philippe Gachon, who's the principal investigator on a big project. In fact, it's a big network in Quebec that's called the Intersectorial Flood Network, and who's trying to reach out, as you know, and as many of you have experienced elsewhere in Canada, there's been increasingly more flood in our country than ever, and the impacts are quite numerous. And today, Philippe is going to address the impact on health and the psychosocial and health impact of flood, and talk to us also about this network that brings together a lot of researchers from many disciplines and also partners from various fields of work. So, Philippe, ce serait à toi.
Okay, thank you so much, Johanne, and also thank you everybody to be there. I will speak about the RIISQ network, the network that we founded by the FRQ, Fonds de Recherche du Québec, that we started 1 year ago. In other words, I will introduce briefly a few things related to the RIISQ network, but also ongoing work that we would like to pursue over the following years. Okay? Everybody can see the screen, it's okay? Good. First, different kind of subject that I will also introduce to you according to the needs for sure to work on the floor. But before to do this, I will maybe introduce a few things related to climate change and the associated risk, especially related to health impact. Also the context related to the specific national and also regional circumstance, but also the main concern that we have, especially here in Canada, but also in Quebec, related to flood. And why we need an integrated and also intersectorial approach to talk about and to tackle the flood and also the flood management. After this, I will talk about mainly on the risk framework and also goals, the vision and mission, governance, objective of the network, the axis of development, but also different kind of partners, because such as you will see, the RIISQ network is a collaboration among all universities across Quebec and also with different kind of partners. I will also take time to speak about and also to present a few things related to health and psychosocial impact of flood, especially briefly related to the work of my colleagues, Susan King from University of McGill, who work on a pregnant woman, and also another studies in which I am also involved with my colleagues, Dr. Melissa Généreux, come from University of Sherbrooke, in which she leads a project related to the post-event after the spring last flood that we have here in Quebec. We have an ongoing work related to a survey, but also different kind of qualitative and also quantitative information that we would like to take from the person who was affected by the flood. And at the end, the conclusion and next step. Is okay, everybody, is there any problem to hear me? Johanne, c'est correct? Tout le monde m'entend bien?
Oui, je crois que tout le monde t'entend. Anybody, if you have any issue, please write a few words in the chat. I'll be monitoring it, so making sure that you are all listening.
Okay. Okay, for sure, the climate change is stressing populations through different kind of weather event, especially heat wave was also a big concern last summer, especially in Europe, but also in Australia. For example, drought, wildfire, heavier rainfall, but also storm and hurricanes. And also, for sure, the flood is one of the big concerns here in Quebec, but also in Canada. in kind of number of disaster per type, you can see from the UNESDR, the National United Nations International Strategy for Disaster Risk Reduction, the combination of statistics from different kind of natural disaster. And we can see here clearly that the highest or the more familiar or more common type of natural disaster events come from flood. Around 43% in terms of the total amount for all natural disaster. In terms of number of people affected by flood across the world, for the last or since 1998, there is around 2 billion of people affected by flood. It's the most important, again, disaster who affect a huge amount of people. And in terms of death, around 11% compared to the stronger or the most common type of event who are responsible for a huge amount of deaths is for sure the earthquake. After this, you have the storm or cyclone event, and also heat wave. And after this, you have also the flood. In other words, for people who are affected by flood, it's the most important kind of natural disaster, but also in terms of death, it's a fourth compared to other kind of natural disaster. Now, in terms of health effect, for sure, the immediate danger is the exposure to toxicant, but also waterborne microbe, but also drowning for sure, and also other kind of injury, around 1/3 compared to 2/3 for the drowning direct impact. Delay effect, its mortality increased by around 50% after the event, and also mood and respiratory infection, especially people who live in the area in which there is a huge amount of humidity, but also the humidity is affected by or where the people live. The other kind of delayed effect is also related to hypertension, double the first month after the event. In terms of mental health, there is an increase in distress up to 2 years, but it could be also longer than around 10 years, such as my colleague Daniel Malte has shown for different kind of disaster that we have here in Quebec. Women also are most vulnerable, especially for post-traumatic stress disorder, especially for women who are also pregnant. Especially, there is also a direct and indirect effect for people, and I will give you some more detail at the end. Now, the context, specific context for Quebec, but also Canada. In Canada, flood account for around 40% of all natural disaster, the most common that we have here in Canada. Flood account for around 75% of the disaster financial assistance arrangement from the government of Canada. This fund is also to help provincial state or province who are affected by different kind of natural disaster. In Quebec, it's a big concern because around 80% of all municipalities are directly and indirectly affected by flood. But also here in Quebec, but also it's okay for the strong majority of area in Canada, the water cycle are particularly affected by ongoing and future climate change, especially big river that we have, for sure the Ottawa watershed, but also St. Lawrence River. Why particularly affected? It's because we have a mixing, especially spring flood are strongly affected by both rainfall, liquid precipitation, but also the thawing of the snow that we have over the winter season. In other words, a combination of thawing of snow, but also liquid precipitation in spring are also one of the two main drivers of the flood that we have here in Quebec. And those are particularly affected by, for sure, the warming and the trend and the rate of warming that we have recently, but also will have in the following years. In terms of vulnerable people, especially here in Quebec, I'm not sure for the rest of Canada, but we have also currently year-old people more than 65 years, correspond to around 20% of the old people here in Quebec, but there was a strong increase, especially over the following 10 years, with around a rate of around 30% of these year-old people by early 2031. And this for sure will increase the potential direct and indirect effect on vulnerable people, but also in terms of exposure, we will have also an increase in terms of a growth in terms of exposed people, strongly related to the immigration, but also continuity in the demographic, but also socioeconomic development. Also the context compared to the rest of the world, in the last 6-7 decades, the rate of warming is around 0.73 at global scale for mean annual temperature. In Canada, it's around 2 times the rate of warming in the world, but also in the north of Canada, it's around 3 times the rate of warming that we have at global scale. In other words, over the last 7 decades, Canada has warmed twice compared to the rest of the world, and also in the north, 3 times the rate of warming that we have at global scale. In the future, it's an ensemble average value from different kind of regional climate model. The rate of warming by the end of the 21st century using the RCP 8.5 scenario, in other words, business as usual, there is no real Paris Agreement, and also will continue to consume, but also to increase the emission greenhouse gas in the atmosphere. At global scale, we will see an estimation of the warming come from the IPCC around 3 and 4 degrees C at annual scale, but for Canada, it means around between 5 and 10 degrees C of warming. In other words, again, 2 to 3 times the rate of warming that we will have in the future compared to the rest of the world. In terms of precipitation, you can see here in green value, all the green and also blue color means there is an increase compared to the current climate in the future by the end of the 21st century. Again, the same RCP scenario, meaning that the increase of precipitation, especially in spring, but also in winter, could also potentially influence the risk of flood, whatever the months. For sure, with the higher value of precipitation, and also it could be in spring, but also in winter, with also a warming during that time, this could also influence the rapidity of the thawing that we have, especially for certain part of the river, basin scale river, but also this could also influence the potential risk of flood. Now, rapidly also come from the IPCC, I will also mainly insist on the last line here, for all North America by the end of the 21st century, for sure there is an increase in terms of risk of flood for both urban but also coastal areas. And this will also increase the risk for health but also infrastructure. You can see here on the right part of the table that according to the rate of warming especially, excuse me, as soon as we go, for example, for warming around 2 degrees C, the risk will increase compared to the present condition. And also here you have also this part is come from the contribution come from the adaptation also to contribute potentially to reduce the total risk. But after we will also go further to the 2 degrees C, especially at 4 degrees C, there is an increase in terms of risk, but also the adaptation will not be able to compensate the amount of risk that we have at this kind of rate of warming. In other words, higher warming means also higher risk, with also potential to reduce adaptation capacity to decrease the amount of risk that we'll have in the future. Now, why, before we go to the flood network, why we need an integrated and also intersectorial approach to tackle with the flood management? It's because despite years of active research but also effort, research has mainly remained, to disciplinary silo. In other words, we collectively fail to provide integrated solution to the complex issue of flooding. But also flood means different kind of factors, especially for the occurrence of flood, but also it's not only come from natural hazards, for example, meteorological system. The flood are also partly responsible for the management aspect, but also the fact that a strong majority of people would like to live close to the river, but also close to a lake. In other words, there is also a management issue that we need to tackle, but also communication aspect, policy, legislation, etc. It's the reason why flood risk management requires cross-sectorial research, bringing together many disciplines from both natural, human, social, health science, communication aspects, etc., etc. The intersection of fundamental but also practical approach and also knowledge can not only increase our resilience, both societal but also environmental resilience, but also allow a strengthening of our adaptability and collective innovation. In order to prevent but also to reduce the risk and consequence of flood, we need to, for sure, develop cross-sector skills to mobilize, to better invest the effort of research, management, but also intervention, and also to fill the gap between the advanced knowledge and its application, but also including the appropriation of knowledge. It's one of the aspects that we need together to focus on. Now, it's the reason why the RIISQ has been developed and also followed by the FRQ. It's an intersectorial network in which we have two main missions. One is to help to reduce the risk of flooding and its consequence, but also to facilitate the resilience of organization, community, individuals to this kind of event that are worsening as a result of climate change, especially such as I have briefly shown before, according to the rate of warming and also kind of precipitation change that will have in the future. The vision of the RIISQ is inter-institutional, multi-organizational, and intersectorial network of innovative research partnership, and also training to build a society that is more resilient to flood. Rapidly, we have a governance structure in which we have a management committee, for sure, a council of direction in which we have also representatives from both university, but also socioeconomic partners. The FRQ are funded organism, but also a representative from the RQM, Réseau Québec Maritime, who was also a kind of network that will follow, especially to organize, but also to structure in the same manner that the RQM has set up is developing in the recent past. We have also a scientific committee in which also we have both representatives from university, but also representatives from different kind also of socioeconomic partners. In other words, because we have a network in which we would like to develop a co-constructed project, we need to be sure that the scientific committee will also engage or also include socioeconomic partners. Another also advisory committee to have both representatives from Canadian institutions, but also international experts, especially World Health Organization is also involved in the advisory committee. The main goal, the primary objective, is to contribute to the development of cross-disciplinary research on flood, but also provide answer and a solution to the need of community and individuals. We have 5 axes. The first axis is mainly related to the knowledge of risk, the different kind of factors who influence both the occurrence but also the severity of flood, come from, for sure, such as I mentioned, the hazard, but also vulnerability, but also exposure aspect. Second axis is focused on the management, but also development of territories at risk of both exposure, but also vulnerability. And there is also in this kind of axis the governance issue that we need to take care, and also legislation aspect. Third axis, in which we have, for example, Johanne is involved in this axis, biological, psychosocial, health, and also economic impact, and also associated also with cost sharing, especially for the insurance aspect. The fourth axis focus on the transformation and reduction of vulnerability, both individual, organization, and also community level. Axis number 5, it's mainly the transversal axis in which we need to share, but also to develop risk management, and also communication aspect, decision-making tools for adaptation, but also resilience. In terms of partners, we have 16 universities across Quebec and different kind of socioeconomic partners, provincial but also federal level. Uranus is here. Different kind of department in Quebec, but also in Canada with public safety, ongoing discussion, environment and climate change Canada for sure, natural resources, transport. We will also have some discussion with Health Canada and also with the Public Health Agency of Canada. Different kind of institutes, especially the INSPQ, Institut National de Recherche Scientifique du Québec, is also involved with us. Different kind of association, organism, municipalities for sure, federation, and also ONGs such as Red Cross and also Salvation Army. Especially they are part of the advisory committee to be sure that also we take care about the people benevolent, but other who are also strongly linked with the people affected by flood, especially during the intervention aspect. In terms of health and psychosocial impact of flood, example of ongoing work, such as my colleagues from McGill, Susan King. She works also with different kind of disaster aspect, with the, for example, contingent of pregnant women in US recently affected by the Harvey cyclone in Houston area. She also discovered, with also collaboration with US, that the disaster has a direct effect for sure on mental health, but also healthy behavior, especially also on the mental health of the woman for sure, but also an effect on the birth, but also kids, especially after the arrival of the babies, on the cognitive development, but also maybe an increase in terms of potential obesity aspect, especially for people affected by a disaster during the period in which the woman was pregnant. Now, briefly, a presentation about the ongoing studies that my colleagues, Melissa Généreux, come from University of Sherbrooke, leads after the last spring flood that we have here in Quebec. The main idea behind this project is to optimize the health services and also post-disaster psychosocial intervention, especially to improve the resilience of community. It's a mix and also multi-centric research funded by the Fonds Vert, le Plan d'Action Changement Climatique of the Government of Quebec. Melissa leads this project, and this project involved my colleagues from University of Quebec at Chicoutimi, Danielle Maltais. She's a specialist on a mental health aspect. She has written recently, for example, a book related to the file that we have after the I have forgotten. Anyway, she's a specialist on different kind of mental health aspect related to different kind of hazards. And myself, because I also contribute, especially for the hydrometeorological aspect. The main goal of the project is to document the health and vulnerability state of communities in relation to the recent flood, but also to propose solutions for stakeholders to mitigate the impact of future events, especially on population. A brief statistic comes from the recent flood that we have in Quebec. We have more than 1,000 homes flooded, more than, well, it's close to 10,000 people affected by all. Affected, but also around 7,000 people were evacuated. Many people affected by the flood also that we have 2 years before. In other words, a regular exposure in terms of flood, especially for people who live close to Montreal, Laval Island, but also along the Ottawa River. For sure, there is a huge amount of stress and also losses, especially both material but also human. There is also a different kind of impact on both physical but also psychological health aspect. And also no similar large-scale survey has been conducted before these kind of studies. The idea also in terms of objective is to describe the population affected by the flood, to document the consequence of flood on physical but also psychological health aspect, to identify the risk and protection factors, but also to determine the most effective intervention strategy to support resilience. In terms of methodological aspect, there is quantitative component in which we have also some documentation letter that we company has sent to 1,500 households living in flooded area across 6 different regions of both Montreal, Laval, Montérégie, Laurentides, Ottawa, Mauricie, whole region affected by flood in 2019. Questionnaire also has been sent, but also some interview has been done also by phone. there is a company who take care about this kind of survey. The sampling started in last December and also will end by the end of this month. And normally we're supposed to have around 3,000 respondents, especially also 1,000 related to the Saint-Martin-sur-le-Lac, the area in which we have strong damage after the rupture or the dam failure, and also people was strongly affected, especially for these particular municipalities. Data also will be coupled with the hydrometeorological assessment. I will briefly talk about this at the end. In terms of people, will not take 2 times in terms of to pass through this table, but just to summarize about the fact that we have also different kind of people who live in different area, with people where residents was affected by the flood, but also in number of people in terms of number also reflects the area in which we have a strong damage, but also strong amount of people affected by flood. Also, other aspect of methodology, we need to have also 3 kind of levels in terms of exposure for people who were flooded, but also partly disturbed and not affected. Just also to have an overview about different kind of answer response from this 3 level of exposure. There is also social health issue address in terms of global health, respiratory health aspect, lifestyle habits, psychosocial health aspect, and also support and service received during the flood period. Also other kind of information that mainly on qualitative aspect, with a discussion group for both at the level of emergency measure manager, but also psychosocial workers and also municipal stakeholders. It's also a manner to also to have an overview, and also the feedback come from people who was also affected directly, but also who has helped people affected by flood. Approximately also 1 group category of respondents in each selected region and different kind of topic address. Now, and also we will combine this population, but also survey, but also qualitative, but also quantitative information come from people, and also will combine this with the hydrometeorological assessment to better document the flood exposure, using, for example, the area exposed to flood. I will show you an example of this for the Laval Island, in which you can see here the red circle represent the area, the zip code in which we have some people affected by flood, compared to no color scale in which there is no people affected by flood. In other words, we will also follow the progression of the flood during the time, the water level per street, per area, to also to document not only the progression of flood, but also the duration of flood for each specific zip code, and also will combine this information with the population survey that Melissa and Daniel have organized. Now, in terms of conclusion, for sure, climate change will affect natural disaster and also potentially increase the severe flood event, especially for Canada and also for Quebec. Every disaster will have the potential to affect 3 generations. For sure, young kids, but also a new baby, especially from the work of Suzanne, who has shown that there is a potential direct and indirect effect on a baby before, during the, and also during the period in which the woman is pregnant. For sure, parents and grandparents, especially because there is also a huge amount of people. We talk about 80% of municipality affected by flood. In other words, we have a certain amount of people who live there. For also people who are also retired, they also are considered as a vulnerable people. In terms of stress, there is an objective exposure, for sure, subjective distress, but also cognitive appraisal, but also cognitive effect that we need to also to consider. In terms of priority of action, we need for sure post-disaster policies and recovery principles, especially come from the recent flood. The strong majority of municipalities has also put forward the needs to have also recovery principle or criteria that they need to follow, especially after the event. Definitively, there is a need for prophylactic intervention, but also prevention. We need to combine field expertise, practical knowledge, and also research, both theoretical but also applied, on flood risk, but also including lesson learned after the event. It's important also to take some lesson learned, especially from the recent past event, but also future event as soon as there is a certain amount of damage. To improve the understanding of the risk of flood, but also consequence, especially the domino effects, because there is a direct and also indirect effect during the time after a certain amount of years after the event. To improve our understanding of the vulnerability, adaptation, but also resilience of individuals, organization, and community. Also, we would like to also to introduce some, especially for management aspect, some integration of different kind of approach, especially to follow certain approach developed in Europe and also in France, for example, to have a circle type of procedure before, during, and after the event, to be sure that also we take care about the lesson learned, but also to work before the next flood or the following flood on communication management, especially to improve the awareness, but also prevention. To work on the land development and also for exposed area. And there is a huge amount of discussion, especially here in Quebec, on a management issue and the fact that we need to follow certain criteria and not to prevent potential new people who will be affected by flood in the future. And also to work on to help to contribute some early warning system or alert system, but also such as developed, but also suggested by different groups and also different countries in Europe. Not only alert system based on the hazard, but also based also on the impact. For example, to combine the likelihood class for the occurrence of the hazard, but also combining the impact in terms of different kind of impact over the ground. To have also a capacity to develop a combination of the hazard occurrence and likelihood of the hazard with also the impact type of level. I think RIISQ has also recently released a project call last January with the application deadline by mid-March or after the March 20. And also we'll also this week launch a scholarship program also to fund some fellowship for both undergraduate but also graduate level for students. Thank you so much for your attention.
And I invite anybody who have questions just to put them in the chat box, and I'll be reading them aloud, and then Philippe can answer. So the first question, very much connected to the coalition objectives, is the RIISQ group involved in research collaborations with any low-income countries also severely affected by flooding? For example, Nigeria. So this question comes from Nick Neufel. And so if you would, Philippe, address.
Yep. Yeah, definitively. After 1 year of development, the following step will also be to increase the network and also the networking across both Canada, but also at international scale. For example, we have a very interesting discussion with Marc Laporta and some colleagues from the World Health Organization, especially related to the resilience aspect, but also to work on the lesson learned from the health and also population aspect, in which also we need to also improve and also engage some discussion with poor and also income country, different kind of people affected by natural disaster, to help, but also to have some lesson learned from other people, but also other countries affected by this kind of disaster. Definitively, there is also a very useful and also a really relevant thing that we need to learn from other experience across the globe, for sure.
Yeah. Thank you, Philippe. And I must say, if I can, as a member of RIISQ, Vic, that if you have any colleagues that you feel would be interested in collaborating with the group, do not hesitate to send them to us, to Marie, the coordinator. And then I have questions from Ollie. Who first says very impactful presentation, and says thank you. She has some questions. So the first one is, I'll put the 3 questions. She has 3 questions, and you can also have a look at them in the chat box because it's visible for everybody. You don't have to suffer my English way of speaking. So the first question is anyone looking at ecological determinants of health, such as impact of fisheries? And other questions is, are rural and remote communities included? And the next one, are you looking at runoff impacts, for example, from agriculture or heavy industries?
Good question. I will answer first to the first and the third question. Definitively, there is a need, and also some group would like to take care about the ecosystem impact, but also factors related to ecosystem, from both the potential effect on the occurrence of flood, but also the impact of flood on the ecosystem, contamination, agriculture aspect, especially agriculture, especially about it's a case in Quebec, but also it's a case in the strong majority of area in which we have some flood over the plain. Strong majority of area also affected or will affect or are affected some area in which we have agriculture development. And we know that there is, especially after the flood that we have here in the Richelieu River, there is some area in which we have some certain amount of contamination from industrial area, but also contamination of toxicity come from the agriculture, but also other kind of direct and indirect effect come from flood on the agriculture play. The second question was, can you repeat?
Yes, of course, are rural and remote communities included?
Yeah. We discussed with the Union des producteurs agricoles, producteurs of agri-food here in Quebec. Yeah, because we need to consider not only urban area, but also we will consider also urban, non-urban area in which we have also concern related to agriculture. And also other issue that we need to consider, the autochtone also aspect, because last week I have also some discussion with people who live in the Pessamit area close to the north of the shoreline of the Gulf of St. Lawrence, in which there is also big river, and they are also affected by a certain amount of flood that are also used for their own fish and also health, not health, but food security aspect. In other words, yes, the work will include urban, non-urban area, but also autochtone and also people directly and indirectly affected by flood that normally we do not consider on a regular basis, especially farmers, but also people who live outside certain area of, big area, for example, outside Montreal.
Does this answer your question, both Oli and Vic? And you can, given that we're not a lot of people online, feel free to open your mic and ask your question aloud if you want to. You're welcome. Okay. Anyone else has a question for Philippe? Or maybe I may have one because like Canadian Coalition is very Canadian. And how do you imagine working with other people in Canada and their already existing relationship with other countries, or do you have any plans around that?
Yeah, for networking across Canada, we start to engage this, but also definitely the health aspect. This ongoing discussion presentation will also open a door. For example, we have some discussion in the recent past with the Global Water Future, Apogee and ESCER network on the water set up by the University of Saskatoon. And there is a very nice kind of relationship that we could also develop across, especially mainly related to modeling aspect, but also risk factors. But definitively, there is a need to develop a collaboration and networking on the health aspect. The work that, for example, Melissa has started is really interesting, and I'm pretty sure that it will be really important, also useful to develop, but also to engage with other area in Canada. For example, also Susan King has worked with the mental health aspect after the forest fire that there is in British Columbia in, I've forgotten the name of, it was in northwest of Alberta in 2017. In other words, there is also some interesting thing that we also have some from the feedback of this kind of disaster, natural disaster. But definitively for public health and also psychosocial health aspect related to natural disaster, there is a clear need to develop a collaboration with different groups and also across Canada, but also across North America. We have also some discussion with some group who work on this aspect in US. And according to the rate of warming that we will have in the following years, according also to the kind of natural disaster that we have across North America, with different kind of hazard, we have a needs to improve our capacity to share knowledge, to share expertise, but also to develop our common background to improve the capacity to be more resilient at continental scale, for sure.
Well, thank you very much on this. Also, Vic has alerted us a new Canadian organization called Canadian Institute for Climate Change. Would you like to tell us something about this?
Yeah, it's a brand new organization. I put the website on the chat box there. It just came out a week or two ago. So it's a very thorough group of colleagues from across the country, I think funded by the Federal Department of the Environment, about, as it says, climate choices. So I really recommend people to get familiar with that. If I just might make two other comments. One regarding links with colleagues in developing countries. I've been in touch with IDRC over the last several months because IDRC is just developing their next 10-year strategic plan from 2020 to 30, asking, is climate change going to feature prominently in that plan? And I'm assured that they talk about 4 pillars. I haven't seen the draft, but 4 pillars in that plan, and one of these is about climate change. So I think we should all sort of keep tuned to when the new programs are defined for from IDRC about possibilities of linking with colleagues such as the one Nigeria that I mentioned in my earlier note. The other comment is that I think our own working group in the coalition on the health impacts of climate change could be a vehicle for links across Canada. I know that David Zakis is just starting to put a list together of like-minded organizations across the country. Now that I'm living in Victoria, one of these certainly would be the one in BC called the Pacific Institute for Climate Solutions. It funds climate change research in BC. Very good reports on it. For example, the impacts of the BC wildfires in 2018, in particular in 2019. Anyhow, let's do our best to connect across the country about these things, for sure. That's my comment about that, Johanna.
Okay, and thank you very much. Those are really interesting, and we should maintain like contact. Of course, I'm both part of RIISQ and the working group, so there's a link there, and there's also a link because I'm also part of the ECO network that you're talking about, Holly. So if you would look at the chat box, I'm sorry, Holly is pointing out a collaboration, so intersectional network that focuses on the cumulative health impact of resource development, and they've developed quite a few tools about, and I didn't know it included any of flood-related indicators. So we're reaching the end of our meeting. And do you, I have a feeling that my connection is unstable. Do you read me, everybody?
Yeah.
Okay, good. So, well, I thank you very much, Philippe, for having accepted to present this network to us. Thank you. And thank you, everybody, for being there. despite our last minute announcement, and we sure hope that this will bring about more work that we can do together. So I don't know, Alexandra, do you need, is there anything you would like to say for the working group or Vic, or shall we just?
Everything is good. Many thanks to everyone. It was a very interesting presentation, and Joanne, if you just want to make sure that you record that on your computer, then you can send me the recording and we could put that on our website.
Okay, I will do this afternoon.
Wonderful.
Okay, well, thank you again, everybody, and we'll see you at our next webinar.
Thank you so much. Bye-bye.
Bye.
Good afternoon.
Merci.
Bye-bye.